Good afternoon, and welcome to today's webinar titled Connecting You to Benefits, an overview of social work case management services for 9/11 responders. We are happy to provide translation services for today's session. Please locate the globe icon at the bottom of your Zoom page and select Spanish or Polish if needed. This webinar will provide an overview of social work case management within the World Trade Center Health Program at Mount Sinai, as well as review types of support case managers can offer to patients in need. Please use the Q&A function to ask questions. It is now my pleasure to introduce today's presenters, Gaby Araya and Amanda Arita-Valentine. Gaby is a licensed master social worker who has been with the World Trade Center Health Program for 4 years. In addition to providing case management services, she serves on the Social Work Advocacy Committee at Mount Sinai Hospital and has presented complex cases, translating clinical insights into targeted psychoeducational content for diverse audiences. Amanda is a licensed master social worker who has been with the World Trade Center Health Program for 3 years and with Mount Sinai for 10. She supports individuals struggling with complex medical and social needs through an approach centered on reducing barriers to care and providing holistic support. Thank you for presenting today, Gaby and Amanda. Gaby, I will now pass it over to you.
I'm muted. Can you hear me?
Yes.
Okay, wonderful. Hi, everybody. Thank you so much for joining us today for this presentation about how social work case management at the World Trade Center Health Program can help support you. My name is Gaby, and I'm a full-time case manager here with the World Trade Center Health Program.
Thank you, Gaby. Hi, everyone. As Marcella and Gaby mentioned, my name is Amanda, and I, like Gaby, have been a social work case manager at the World Trade Center program for 3 years.
Great. Thanks, Amanda. Let's jump in. So here is a look at today's agenda to give you an idea of where we're headed. We, of course, have started with our welcome and introductions. Then we'll move on to the social work case management overview and answering the question, how can social work case management help you? Next, we'll move into discussing the World Trade Center Health Program and the Victims' Compensation Fund. From there, we'll go into some real-life case examples showing you how social work CM, or case management, has been helpful for our members. Then on to some reminders, and lastly, we'll have time for any questions you might have during our Q&A. Let's get started. Since you're here with us today, at some point, you may have asked the question, what exactly is social work case management within the World Trade Center Health Program, and what kind of support is available? Well, we, as social work case managers, act as resource connectors, and we offer support one of 2 ways based on your specific need. We're able to provide explanation for and refer you to resources internally within the hospital system or externally through accessible community resources. In this resource connector role, our goal is to find you specialized assistance and support to navigate complicated systems inside and outside of the program. When folks hear the term social work case management, it's not always clear what that means or what kind of help you can expect. So I want to take a few minutes to explain what social work case managers can help with, and also be clear about what's outside of our role. First, it's important to know that social work case managers are here to support you. Our role is to help you navigate systems that can feel confusing or overwhelming, and make sure you're connected to the right kinds of supports and services. Social work case managers can help explain benefits, talk through options with you, and connect you to agencies or specialists who can support applications, appeals, or any next steps aligning with your specific areas of need. If you're feeling stuck, unsure where to start, or overwhelmed by the process, social work case managers can help break things down and make it feel more manageable. Another important part of our role is supporting mental health. We can offer education around mental health concerns and help connect you to counseling or other mental health services, either within the program or through your insurance. Lastly, if you're looking for assistance with World Trade Center related medical concerns, we can assist by connecting you to the nurse case managers, SMCs, and other administrators on the physical health side of the program. Those on the physical health side of the program can help with certification questions, medical appointments within the program, authorizations, prescriptions, and treatment appointment questions. There are also a few things that social work case managers are unable to do. We aren't able to sign patients up for health insurance, complete tax forms, fill out Social Security disability paperwork, or Victims' Compensation Fund claim on your behalf. We also don't provide ongoing structured therapy, nor do we offer legal or medical advice. Now, that said, just because we don't do those things ourselves doesn't mean you're on your own in trying to access those services. Instead, we can guide you to the people and organizations who do specialize in those areas. At its core, social work case management is guidance and connection. We take time to hear what you're going through, walk through options, and figure out together what kind of support would actually help. If you're ever unsure whether something is within our role, please ask. Even when something falls outside of what we do directly, we'll do our best to point you in the right direction.
Thank you so much, Gaby. That was a really great overview. And now I'll continue by sharing some of the most common referral reasons we receive as social work case managers to give you an idea of the kinds of things we can help with. So if you have questions about the 9/11 Victims' Compensation Fund, we can help connect you to VCF representatives that can guide you through the application process. If you have questions about workers' compensation, we also can refer you to workers' comp specialists within Mount Sinai so that you can receive support in filing your claim. If you are interested in applying for SSD, Social Security Disability, or any other type of public benefit, we can connect you to city agencies that offer assistance with determining your eligibility and assist you with submitting applications. In addition, if you need assistance with an SSD appeal, if you've been denied in the past, or if you have any other legal situation that affects your health, you may be able to be referred to NILAG, which is a free legal service that is offered through Mount Sinai. NILAG often assists with situations regarding advance directives, Medicaid pooled trust, among many other legal issues that can be impacting someone's health. And as was previously mentioned, social workers can also help connect program members to mental health services, either within the program or through your own insurance network. And if you see on the other side, there are also some referral reasons that are considered urgent and would result in contact with a social work case manager within 24 hours. These urgent reasons would include if someone was facing immediate eviction or removal, food insecurity, homelessness, a mental health related hospitalization or detox, and actively managing severe mental illness. A social worker would usually reach out to assess the member's situation and provide appropriate referrals in a timely manner. And although these are some of the most common referral reasons, we always urge anyone with questions to reach out to give us an idea of your individual situation. And As we can already start to see, the World Trade Center program is a big program, and it can sometimes be hard to know where to get an answer from. Social work case managers can support you by helping you understand your options and connect you to services within our program. When we're looking internally at hospital and program resources, we can assist patients in navigating internal needs, such as explaining your physical and mental health benefits through the World Trade Center Health Program, helping you access and understand health insurance options, including Medicare and Medicaid, coordinating medical care outside of the World Trade Center Health Program when needed, connecting you to the workers' comp specialists within the hospital, assisting with health-related legal concerns, and linking you to mental health resources, like we said, either through your insurance or through our program itself. And as a note, social work case managers, social work case management in general is open to all members of the World Trade Center Health Program. And a member does not need a mental health certification to engage in case management services. All members are eligible for social work case management throughout their time in the World Trade Center Health Program. And when it comes to external systems, case managers assist patients by helping them understand and connect to social service programs and helping entities outside of the hospital system. We often discuss disability and Social Security Administration benefits, the Victims' Compensation Fund, known as VCF. We also make connections and referrals to community resources. Some common resources revolve around legal help, food assistance, medications, and some limited employment resources as well. And of course, we're also able to offer transportation support by way of connections to Access-a-Ride or to Medicaid transportation if you're eligible. Social work case managers also help support patients through the mental health intake process. So patients can schedule a mental health intake if they're looking to certify a mental health condition that's related to 9/11. And if you're interested in mental health services within our program, case managers can help you understand your options and connect you to care. We check in as needed during your intake process to help coordinate care and to offer support along the way. After your intake has been completed, we will follow up with you to ensure that you're connected to the most appropriate mental health provider. And if recommended, we can also help connect you to providers outside of the program by using your own insurance. Going forward, after the intake process has concluded, your case manager will reach out every 6 months or so to see how your care is going and to offer continued support. As case managers, we want to ensure that you have the support throughout the entire mental health evaluation process. And we also wanted to give everyone an idea of what an initial case management appointment looks like. So whether you're coming to us for help finding resources or for support with the mental health intake process, the initial appointment is the same for everyone. Together, we will complete a biopsychosocial assessment. And this is a set of questions that gives us a better idea of your current needs so we can develop a plan together to address them. The biopsychosocial assessment will ask questions about income sources, access to food and housing, your own support system, as well as physical and mental health conditions that you may be managing. Your responses to these questions help us determine your eligibility for certain programs or benefits that you have expressed interest in, as well as eligibility for programs that you may not be as familiar with. After your assessment is complete, we'll work together to develop a plan that connects you to necessary resources. This would include referrals to different community agencies or providers that can support you in getting more information and or achieve your goals. Usually, we'll schedule a follow-up appointment within 2 to 6 months, depending on the urgency of each participant's situation. However, if you're meeting with a case manager for support during the mental health intake process, we will usually schedule a follow-up with you within 2 to 4 weeks. to check in and clarify any questions you may have about your upcoming appointment. We also ensure that you have all the details that are needed for you to successfully attend your appointment. And just to clarify, this initial case management appointment is separate from the mental health intake evaluation. So you will have another appointment that will focus solely on your mental health symptoms. So now we'll hear more from Gaby regarding the World Trade Center Health Program and its connection to the Victims' Compensation Fund.
Wonderful. Thank you, Amanda. In addition to what we've reviewed regarding case management assistance, social work case managers can also offer support when it comes to the Victims' Compensation Fund, also known as the VCF. Something we often clarify for our members is that VCF and the World Trade Center Health Program are separate entities. We at the program are not a part of the VCF award determination process, and we operate independently of VCF. However, members are able to obtain a physical health certifications through the WTC Health Program, which can help when filing a VCF claim. Although we're not involved in the determination process, social work case managers can definitely assist you if you're thinking about registering or in the midst of a claim. To create a clearer picture of how social work case management can help you navigate the VCF system, we can see here that case management is not able to register you for VCF on our end, but we can work with you to contact the VCF to get you registered. Although we can't fill out a claim form on your behalf, we can definitely support you in finding answers to questions and concerns that come up while you are filling out a claim form. As mentioned before, we don't have influence over the VCF claim process over here at the health program, but we can always provide in-depth explanations of the VCF program parameters as well as clarifying resources. Now that we've covered social work case management, what it is and how it can be helpful, let's move into some real-life examples of how social work case management has supported some of our members. Here we have DJ, and please note that this case has been de-identified for our purposes today. DJ was first referred to social work case management during her yearly member services visit when she expressed confusion with VCF, a lack of health insurance, and questions applying for accessoride and Social Security disability, as she was injured due to a recent fall that is preventing her from working and accessing public transportation. After meeting to discuss her needs more thoroughly, I was able to refer her out to community agencies that provide hands-on assistance with a Medicaid application and applying for Social Security disability. In following up with case management and community agencies to move through the application processes with support, eventually she was awarded Medicaid and Social Security disability. She had also previously been denied for accessoride services, and with the help of CM, she was able to obtain letters and medical records from her medical providers that were necessary for her appeal hearing. With social work case management assisting her in understanding appeal proceedings and moving through the appeal process with support and advocacy, she was eventually awarded accessoride services. While working to accomplish and clarify her identified referral needs in case management, over time, we discovered additional concerns she had. It turns out that she also needed a new primary care provider to obtain a medically necessary walker. In navigating this approval process through Medicaid, her cognition started to decline and became a concern. At this point, I was able to assist DJ in processing her circumstances and assessing best suited resources. We went on to discuss the possibility of home health care and how she felt about this big shift in her independence. In processing with her what was best for her care, We pivoted and started to explore the Consumer-Directed Personal Assistance Program, also known as the Medicaid-eligible CDPAP program for chronically ill or disabled people who need assistance to stay in their homes. This program allows them to personally select a trusted family member or friend to act as their caregiver instead of a traditional home health aide from an agency. In time, her son became her CDPAP caregiver. It wasn't until her son stepped in as caregiver that they both recognized the mental and emotional toll her time at Ground Zero had on her. At this point, social work case management was able to refer DJ for a mental health intake with us in our program, and she was ultimately certified with a 9/11 related mental health condition and was able to start treatment within our clinic. This is quite a complicated case, and to sum it all up, in working with case management, DJ received guidance around the Victims' Compensation Fund, home health care, accessoride, acquiring health insurance, CDPAP services, and World Trade Center Health Program mental health intake and certification.
Thank you, Gabby. And I'm now going to share another example of what social work case management can look like using another past case with all identifying information removed. So MJ was referred to social work case management during their annual monitoring visit. After meeting with a member social services, excuse me, after meeting with a member services social worker who conducted an initial assessment. So MJ presented with legal needs that were having a negative effect on her mental and physical health. She was also looking for assistance in applying for Social Security disability. And since her anxiety made it very difficult to complete any kind of paperwork, she was requesting support with that. And lastly, when we spoke a bit more about the source of her anxiety, she shared that her anxiety symptoms started around 9/11 and that she would be interested in receiving treatment through our program. As her case manager, the first thing that I did was slow things down a little bit. We talked through what felt most stressful and focused on one step at a time. I connected her to NILAG, which is a legal health service through the hospital, so that she can get help with her legal situation and learn more about accommodations that might be able to support her. I also referred her to Sydney, which is an organization that helps people with disabilities, so she could get support with the Social Security disability application in a way that worked for her. And I also referred her for a mental health intake. The intake is an important step, right? Because it helps determine whether a mental health condition may be related to 9/11 so that services can be offered through our program. And when I first began working with MJ, we were addressing a few specific needs. And as we continued our work together, another concern came up related to housing. She shared that she was living with several roommates and that the situation was no longer working for her. This example shows how case management can help address multiple needs and provide ongoing support as situations change or new concerns arise. So throughout our work together, my role was to explain options, collaborate with her to create a plan of action, and help her connect to the right support. This is what case management is about, right? Meeting people where they are, going at a pace that feels safe, and helping make complicated systems easier to navigate. If you ever feel overwhelmed, stuck, or unsure of where to start, case management is here to help. And now we would like to review some of the information we shared, as well as some additional tips. There are two main ways to get referred to social work case management. You can either get referred by a member services social worker at your annual monitoring visit. You can also call our World Trade Center mental health clinic at the number that shows on your screen in bold. Or you can request a social work case management referral from any of your World Trade Center physical or mental health provider. And lastly, the social work case manager's role, again, is helping you reach your goals by connecting you to specialized assistance and supporting you in navigating complex systems. And before we go, we'd like to take a moment to remind you that social work case management is open to everyone. All World Trade Center Health Program members are eligible for case management services throughout their time in our program. And if you are unable to leave your home for medical or other reasons, we also offer case management remotely. And lastly, we offer direct case management services in English, Polish, Spanish, and Russian, in addition to translation services for any other language you may speak.
All right. Thank you so much for that info, Amanda. And now we've reached our Q&A portion. So thank you so much for your time and listening to us today. And feel free to ask us anything you'd like.
Thank you, Amanda and Gabby. If you could please use the Q&A section to ask any questions you may have. All right. One of the questions is if I need to complete a Social Security disability application, can you start it for me or finish it and send it wherever it needs to go? Because I'm not sure how to do that. I'm not sure, Amanda or Gabby, if either of you want to take that question.
Sure, Maciel, thank you so much for whoever provided that question. So similarly to how we may have mentioned during the presentation, when it comes to Social Security disability, we'd love to put you in touch with the specialists, the experts at that specific process. So instead of us starting the application for you or finishing it off for you, we think that it is best to connect you to the people who specialize in this process and who are able to offer you information, guidance, and specialized advice as to how to fill out that specific application. So we would be able to get you in touch with someone at Sydney, for example, like was mentioned before, or another agency that is able to comprehensively help you out with that application process. From there, you'll be able to communicate with them and work with them to make sure that your application is submitted in a timely manner and with all of the information that is required. So, long answer short, we help connect you to the experts that can help you out with that application.
Thank you, Amanda. Another question is whether there is a deadline to register for the VCF.
Really good question. So you're able to register for the VCF at any time because the program itself is still open. There is a timeline that has to do with certain certifications, physical health certifications. So if that's something that you're wondering more about, please give us a call and we can talk through your specific case for sure.
Thank you, Gabby. Another question is if I get a medical bill for one of my visits, can my case manager help with that?
Really great question. I can take this one, Amanda. So this is a question that we often get. And what we can do is work with you to determine where that bill actually originated from, where it came from, because that in itself can kind of be confusing. A bill pops up and you're kind of like, where did this come from? Why do I have this? And during that process, of course, we'll dive into explaining WTC coverage and if that's appropriate for the bill that you received. And we can also help connect you to the physical health side of the program, if it's a physical health bill, to iron out coverage for any possible things that come up. But all in all, we can definitely help you determine whether WTC can cover your bill. And if necessary, explore next steps.
Thank you, Gabby. One other question is I feel like I'm having a really tough time since 9/11. I've been feeling down many days and I need help. I am worried that the people in my life will find out if I get help and maybe think that I'm crazy. Can case management help me get some relief?
Yes, I can take this one, Gabby, if that's okay. Yeah, thank you so much for that question. And I feel like that is a, a sentiment that a lot of our members share. Especially if you're coming from a role that is typically, it is not usual to receive mental health care, culturally or professionally. And we really hear you on that. And I feel like being able to get the support from a case manager during the mental health intake process can help iron that out as well. We would love to get you connected to one of our treatment providers, someone who can do the mental health evaluation for you, talk to you about your experience and how that has been manifesting in different like mental health symptoms or different challenges that you've encountered since then. While you're waiting for that process or undergoing that evaluation, we as case managers can, follow up with you. We can check in to see how you're feeling about that situation. And we can also talk about any apprehension that you might have towards engaging in these kinds of services, because we understand that it's not the easiest thing, right? To ask for help when it comes to mental health or other things that might be stigmatized in that way. So yeah, we can definitely get you connected to someone who can speak to you specifically about that part of your experience, and you'll get support from us the entire way. So we would love to be able to support you in that.
Thank you, Amanda. Okay, so for specific information on your personal registration deadline for the VCF, for any benefit or mental health related support, please call 212-241-8462, and one of our social workers will gladly reach out and provide the assistance that you require. Thank you all very much for joining us today. We look forward to seeing you in our future webinars.
Thank you, everybody.